I have been a caregiver for both family members with physical diseases and also with a mental illness. I felt very alone and isolated when we started our journey as a family into the mental health and addiction system. It changes everything. I have been part of the Cornwall and District Family Support Group since 2006. As a caregiver, I wasn't used to working in a hospital, so I had to learn my way around all the hospital systems.
I worked at the Cornwall Hospital since I graduated at the age of 35 as a nurse, and mostly in psychiatry for all that time. I think caregivers felt that they weren't heard, and it wasn't recognized that they were really part of the patient's life, and they were the most important part. We were just there for a little while. They're there for the long haul, right?
There's a number of caregivers in the community who have moved beyond their personal story and do want to get involved in advocating for system changes, and we just brought them all together and co-designed the solutions.
It begins with awareness, and I have to say that in our journey, that's where we started. It was really to bring our frontline providers to the point where they could really appreciate the impact that the caregivers can have on the delivery of service to our clients in need.
A lot of our work has been done on the inpatient mental health unit. We're now identifying caregivers with a caregiver ID badge. There's new discharge planning. We have a discharge checklist for caregivers. We give out a welcome package. There's a mental health caregiver guide in that welcome package that has all kinds of self-care tips. It's very important. The journey is very long with a loved one, and that self-care piece is very important.
I think that we can bring that education, awareness to other providers across the system, and we've been fortunate to have support both from our local partner and the Change Foundation to be able to build solutions.
They want to know that it's okay for them to be there and to ask these questions, and they just need a little encouragement to do that. I'm very happy to see this implemented in a formal way. Did we really value and include the caregiver back then? No, we didn't. And now they're more right in there. They're almost stuck to the patient and caregiver throughout the whole process, which I think is a really great thing.
We're getting feedback from the caregivers, and that feedback is getting better and better. They're feeling appreciated, they're feeling supported.